1 in 8 women will be diagnosed with breast cancer in her lifetime. It's the most common form of cancer in women in the United States. Factors such as age, race, and family history can all affect your risk. Here to discuss more is Dr. James Frost, breast surgeon with Premier Surgical Network in Egg Harbor Township. You and your wife have a long history of breast cancer in your family. How does genetics play a role in that?
My wife and I are of Eastern European Jewish descent, and unfortunately, we have between us over 10 family members who have suffered from breast cancer. We know that in Jewish families there is a higher penetration of breast cancer. Some of this is related to the breast cancer gene. In Jewish families, compared to the general population, there is a 1 out of 50 incidence of the breast cancer gene versus 1 out of 500 in the general population.
That's why genetic testing is so important, and you do it in your office.
We do genetic testing in our office. Genetic testing can either be done as a sputum sample, a swab of the cheek, or a blood sample. I draw blood myself in the office. This assures that I have a good sample, and by sending it directly out of our office, we make sure that we get a very timely result for our patients.
What are some of the genes and how many do you test for?
The routine testing today usually tests for about 40 different genes. Everybody knows about the breast cancer gene 1 and 2, but there are at least 6 other genes that can be culprits in the breast cancer genetic cause of breast cancer.
So if you have breast cancer in your family, it's a good idea to do genetic testing.
It's a very good idea if the breast cancer patient was young, if you have breast cancer yourself, if you're of Eastern European Jewish heritage. These are all good reasons to have genetic testing.
Of course, age and race also play a role. Where can we learn more?
PremierSurgicalNetwork.com.
Thank you so much, Dr. James Frost, Premier Surgical Network.